Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam. I have been a practicing cardiologist for 40 plus years, and welcome to Lectures on Your Heart. The focus of this presentation is what questions you should be asking if you have been recommended cardiac catheterization and a coronary stent placement. So let us begin with some basics. What is a coronary stent? And how is this procedure done? And what are the appropriate questions you should be asking your cardiologist? And most cardiologists are extremely knowledgeable enough to answer all these questions and much more. Okay, basically, when you develop a blockage in the artery, in the coronary artery, you can follow my arrow here. And there's a blockage, plaque buildup in the artery. Then a wire is passed through that blockage, which has a balloon. We initially inflate the balloon to compress the plaque. After that, a second balloon on which a metal wire mesh is kind of compressed here is placed in the location of the blockage. And once it's in the location of the blockage, the balloon is expanded and you can see the wire mesh which is also expanded. And once the full expansion of the wire mesh, the stent, which is made up of chromium and other metals, the balloon is removed and the stent is sort of plastered to the arterial wall and it stays there permanently. Over a period of 6 weeks to 8 weeks, the new endothelial cells develop over this stent and cover the bare metal in most cases. I said in most cases, right? So that is the basic procedure. So what I would suggest is, here are some of the questions. You may want to write it down and make sure you ask these questions. Can you explain the procedure in detail, please? If they have trouble explaining the procedure to you in detail, then you need to stress. Could you please explain to me how is the procedure done? How long does this procedure take? How many stents do I need? What is the recovery time? Generally, the cardiac catheterization with placement of 1 to 2 stents may take anywhere from an hour to 2 or 3 hours, depending upon the location and the complexity of the blockage and also how hard the arteries are. If there's a lot of calcium buildup, they may have to kind of drill through that calcium to put that's known as the atherectomy, and then it is the stent is placed. The recovery time is usually very fast. They may go from the arm or generally they may go from the leg depending upon the indication. And once these things are done, the catheters are removed. The arterial puncture is sealed. There is actually no suture involved in this procedure. That's the good thing. And you are conscious during the procedure. You are given some sedation and you will be able to answer all the questions, and you can ask questions and you can actually see on the television monitor there what is actually going on if you understand it. I hope your cardiologist understands what's going on the monitor. Okay, what are the potential complications? The potential complications are bleeding. Obviously, we are puncturing an artery. There could be a leak from that puncture site. There could be bleeding, which leads to hematoma. Since we give blood thinners, people can sometimes bleed inside the belly, and that can be a major problem. And those are the complications. And sometimes people can develop heart attack during the procedure. If for some reason the artery collapses while doing the procedure, that could result in a heart attack, and very, very rarely patients can get into any significant complications like irregular heart rhythms or cardiac arrest. That is exceedingly rare. The complication rate is like maybe 1 to 2%, which is exceedingly small. And even before we proceed with the procedure, you should ask them, how significant is the blockage that I have? Where is the blockage located? How much of the myocardium is at risk? If it is like a 5% of the myocardium or 10% of the myocardium, then you may ask them, is there any alternative treatment? If I'm having an occasional chest pain, can I take medications to reduce the risk factors and control the pain without having to go through a stent placement? It depends upon the size of the artery, the length of the blockage, and the artery status beyond the blockage. So there are many things that have to be taken into consideration. And the most important thing is, will it prolong my life? Of course, this is a very, very challenging question. Not every stent is going to be able to prolong life. There are situations where if you have blockage of the left main artery or the left anterior descending branch, which supplies like 30-40% of the heart muscle, and by placing a stent, certainly we can improve the symptoms of chest pain. We improve your physical tolerance. We can increase your exercise capacity, and hopefully that should also prolong your life because you are improving the blood circulation in a major branch of the coronary arterial system. But if it's a small distal branch, then you should question, can I just take medications? And hope you find a very satisfactory answer from your doctor. And the next question is, will it cure my heart problem? First of all, you have to understand a stent is placed to address a specific blockage in the arterial system supplying the heart muscle. It is not doing anything to the progression of the plaque in other regions of the heart. For that, you have to take a vigorous lifestyle changes, including cholesterol control, weight control, blood sugar control, blood pressure control, and making sure you are on a regular exercise program. Those things are absolutely essential. They are as important as putting a stent. The stent will basically alleviate your symptoms. And as I said, in important cases like left main artery or the left anterior descending artery, it may also prolong life. But for the most part, the coronary artery disease is a lifelong, slowly progressive chronic degenerative disease, which means we have to do lifestyle changes. That is the real answer to what is going on in your heart, and the stents help you to function better, minimize your symptoms, and improve your physical exercise and tolerance. The next question is, will I need similar procedures in the future? It depends. If you have multiple arteries blockages, they may stage your stent placement in like 2 procedures or maybe 3 procedures. In that way, you can avoid a surgery, because previously people used to go for surgery for 1 artery blockage or 2 artery blockages. Today, even if you have 3 vessel blockage, they can all be treated with stents on like 2 or 3 different settings. So that is important progress that we have made in field of cardiology. How do I prevent further worsening? I already talked about this lifestyle modifications. I don't want to rub that too much because you want to know more from your doctor than the doctor telling you what to do, because you already know what needs to be done. So let's get on. Can I get a second opinion? Yes, indeed, your doctor should be willing to openly help you to get a second opinion. Because if you are having doubt, the last thing you want to do is you want to go for a procedure, and if some complications happen, then you feel bad, the doctor feels bad. The best thing is you just for the peace of mind, you want to get a second opinion, you can get it. You may want to go with the same cardiologist with whom you have trust, with whom you have worked for years, but there's nothing wrong in getting a second opinion. Do the stents prolong life? I already answered this question. As I said, stents are very useful in reducing the symptoms, improving your quality of life, and increasing your exercise capacity. And those are proven facts. And in certain circumstances, stents do prolong life. Not every situation where you're putting a stent for like a 5% blockage, 5% area of the heart muscle involvement, or maybe even less than a 10% involvement of the heart muscle. Okay. a few other things. When you get a stent, you're going to be on aspirin and another blood thinner like Plavix or something similar to that. These blood thinners do carry risk. That is, if you take these blood thinners, you have an increased tendency to bleed. But along with that, you'll also be on medications for your cholesterol, you'll be on medications for your blood pressure, for sugar, and for other problems. As far as stent is concerned, the blood thinners are something which you may have to take for long period. Just ask your doctor, how long do you need to be taking these Plavix or Xarelto or any other medications they recommend. Especially if you have a history of diabetes, the general recommendation is that you should be taking these medications long term. What is long term? Nobody has been able to define what is long term, but they just say you need to stay on it. Same thing when patients go for surgery, they recommend them to be on Plavix and aspirin for a long period of time. So these are some of the very basic questions you should be asking, because it is your life. You're the one who is making the decision. You're the one who is signing the consent form. And obviously, most cardiologists I know are honest people. They try to help you and see what is in your best interest. And if you have any questions, you should be able to clear all those questions. And if you want to get a second opinion, which should be fine to get a second opinion, and who does the procedure, the choice is going to be yours. I hope this has been educational to you. I have similar question sessions on practically every major cardiology topic. You can watch them and become an educated heart patient, because heart disease is a lifelong journey and you need to learn how to live in spite of having heart problem a normal life. Thank you so much. I am Dr. Nik Nikam from Houston, Texas. I'm a cardiologist, and I will see you in the next video.